I'm Bill Fry, Director of American Metabolic Institute, and we're located in La Mesa, Mexico, which is Tijuana, 40 minutes from the San Diego airport, where we provide conventional medicine and complementary medicine. Dr. Rubio's been researching this for over 25 years, where he works with immunology support, re-educating the immune system and putting it back into a working order. Immunology work that we do consists of adult stem cell, gene replacement, live cell, and then we're also working with a big detox program that complements everything. The cancer vaccine that Dr. Rubio develops there is dendritic, as well as there's over 5 other vaccines that he uses and develops in the lab right there at the hospital. He does a culture from the blood or a tissue sample and grows the cancer. Of course, the cancer cells have the lipid and protein coating on the outside that disguises them from the immune system and protects them. So he developed a formula 19 years ago, enzyme formula, that washes that coating off the cell so it's nude and exposed in the petri dish. And then he'll take another blood sample and introduce the lymphocytes and T cells and neutrophils, the immune system that fights the cancer. And they attack and destroy the nude cancer cells in the petri dish and become educated as their number one priority. And then after 12 to 21 days, we'll pull these educated lymphocytes and T cells from the petri dish and administer it back to the patient as a vaccine, just like a smallpox vaccine. And they educate all the lymphocytes and T cells in the patient's body, and as well as the patients had a special IV drip that washes all the protein and lipids off the cancer cells in the patient's system, so the newly educated immune system has access to the cancer cells.